Welcome to this educational video on fungal keratitis, a serious eye infection that can threaten your vision. We'll explore what causes it, how it affects the eye, how it's diagnosed and treated, and most importantly, how you can protect yourself. Fungal keratitis at its core is an infection of the cornea, that clear, dome-shaped front part of your eye caused by fungi. These fungi can find their way into your eye through various routes. The most common culprit is trauma, especially in agricultural settings. Think of a stray twig scratching the eye, or a piece of plant matter entering the eye during gardening or farming. Contact lens wearers are also at increased risk, especially if they don't follow proper hygiene practices or use contaminated lens solutions. Less frequently, fungal keratitis can develop after eye surgery or spread from a bloodstream infection. Once fungi breach the corneal surface, they begin to invade the corneal stroma, the middle layer of the cornea. They release enzymes that break down corneal tissue, leading to inflammation, ulceration, and potentially deep stromal abscesses. This process disrupts the normal architecture of the cornea, causing pain, blurry vision, and light sensitivity. The body's immune response further contributes to the inflammation, exacerbating the damage and potentially leading to scarring. Fungal keratitis, while not as common as bacterial keratitis, poses a significant threat to vision. Its prevalence varies geographically, with higher rates observed in tropical and subtropical regions due to the warmer climates and agricultural practices. In these areas, fungal infections account for a larger proportion of keratitis cases compared to developed countries. Agricultural workers, contact lens wearers, and individuals with compromised immune systems are at higher risk. The symptoms of fungal keratitis can be quite debilitating. Patients typically experience eye pain that can range from mild to severe. Redness of the eye is also a common sign. Vision often becomes blurry, and sensitivity to light, known as photophobia, is pronounced. You might also notice excessive tearing and a feeling like something is constantly in your eye, a foreign body sensation. Importantly, these symptoms can develop gradually over days or even weeks, which can delay diagnosis. Diagnosing fungal keratitis requires a thorough eye examination by an ophthalmologist. This involves assessing your symptoms, examining your eye with a slit lamp microscope, and potentially taking corneal scrapings. These scrapings are then sent to a laboratory for microscopic examination and culture. Identifying the specific type of fungus causing the infection is crucial for guiding treatment. Special staining techniques, like gram stain or potassium hydroxide preparation, can help visualize the fungi. Confocal microscopy can be used in some cases to non-invasively image the cornea and visualize fungal elements. In some cases, a corneal biopsy might be necessary for definitive diagnosis. While there aren't distinct types of fungal keratitis in the traditional sense, we can classify infections based on the causative fungal species. Filamentous fungi like Fusarium and Aspergillus are common culprits, often associated with trauma. Yeast, like fungi like Candida, can also cause keratitis, especially in individuals with underlying health conditions or those who have undergone eye surgery. The specific fungal species involved can influence the clinical presentation and response to treatment. Treatment for fungal keratitis is a challenging and prolonged process. The mainstay of therapy is antifungal medications, both topical and oral. Topical antifungal drops, such as natamycin or voriconazole, are applied frequently to the infected eye. Oral antifungal medications, like voriconazole or fluconazole, may be prescribed to provide systemic coverage. In severe cases, surgical intervention may be necessary. This can range from corneal debridement, where infected tissue is removed, to therapeutic keratoplasty, a corneal transplant to replace the damaged cornea. Treatment duration is typically several weeks to months, and close monitoring by an ophthalmologist is essential. Prevention is key to avoiding fungal keratitis. For contact lens wearers, meticulously follow your eye doctor's instructions regarding lens cleaning, disinfection, and wearing schedules. Never use tap water to rinse your lenses. If you work in agriculture or gardening, wear protective eyewear, such as safety glasses, to prevent eye injuries. Promptly seek medical attention if you experience any eye trauma or symptoms of infection. Maintaining good overall health and hygiene can also reduce your risk. The prognosis for fungal keratitis varies depending on the severity of the infection, the specific fungal species involved, and the timeliness of diagnosis and treatment. Early diagnosis and appropriate treatment can lead to a favorable outcome with preservation of vision. However, delayed diagnosis or severe infections can result in significant vision loss, corneal scarring, and even the need for a corneal transplant. Recent research focuses on developing more effective antifungal medications and improving diagnostic techniques. Studies are also exploring the potential of novel therapies, such as cross-linking and photodynamic therapy, to combat fungal infections. Stay informed about the latest advancements by consulting with your eye care professional.